Agasharu is one of the neighborhoods in Gasabo district, where there are 9 households that were tested positive for COVID-19. However, there are places that have got positive cases and still meet others. The Rwanda National Police Deputy Spokesperson, CSP Africa Apollo Sendahangarwa, says that this is punishable by the law.
In Rwanda's Penal Code, Article 117 provides for sanctions against the transmission of disease to others, such as the coronavirus, which has no vaccine or medication, and the sanction is between 20 to 25 years in prison after the court verdict. This is not good, and when you know you are infected and there are symptoms of the illness like the coronavirus which kills and you're spreading it, it is a punishable offense.
The patients that are treated at home have said that doctors told them that in order to be cured, they should eat vegetables, fruits, meats and drink milk. However, adding that they could not afford because they had to work to provide for their livelihoods. I went for the test and it was positive for COVID-19, and it was necessary that we be placed in isolation at home, and then the means are modest, when we were given only beans and maize flour, while I have young children. For example, this one needs porridge, milk and other things, and I need these fruits too, and we really don't have anything at home except the beans and corn meals we were given. In fact, I would sit here with a bucket, and if someone buys charcoal for 500, I would buy myself fruits, and I would find carrots in the field and other things that can help me. I can't afford it. They just gave us maize flour. Pidas Ruringisa Kigali City Mayor has said that those that are under treatment should stay at home, and those that have food problem would be helped at home.
Those who need supplements on what we can find, especially those households with children, we give them milk. COVID-19 patients who are at home and who do not have to go out for groceries, following the lockdown measures, whoever is sick should stay home for at least 10 days and will have other tests to assess their condition. Anyone who is facing the problem of food, he calls the number, but this is not necessary because there are in particular health auxiliaries who work with the village chiefs to visit them and see if they have enough to eat. And those in need find help in this way. They are not only looking at the diet, but also the patient's progress, but they first visit them and see if they are poor or if they cannot get out to find groceries.
Epidemic Surveillance Response Division Manager at Rwanda Biomedical Center, Dr. Rwagasore Edson, has said that in order to follow and treat those that are at their homes, their names are well known by those that treat them.
It is true that it is worrying when there are sick people who walk around and spread the virus, and therefore we are seeing the right way to do it by collaborating with groups at village level made up of local authorities and health center officials. We continue to publish the names, but in a safe way, because we have confidence in this group, for we do not want there to be errors or disclosure of patients' secrets.
Since the start of treating COVID-19 patients at home, 4,000 patients are followed, whether at home, as indicated by RBC.